Can go ahead.
The good physician treats a disease. The great physician treats a patient who has a disease. William Osler. Good afternoon. My name is Leah Getaneh. I am part of the Daisy Care Health Club at Rhodes Park School. Today, I'm going to talk about a condition that affects up to 68% of women, according to International Journal of Obstetrics and Gynecology, fibroids. Before I begin, allow me to thank my supervisor, Joy Kumar, the executive of Daisy Care Zambia, for giving me this platform, esteemed members of Daisy Care, parents, teachers, members of the public, and my fellow pupils. Here's a table of content on how this presentation will flow, starting from definition up until reference. Please sit back and enjoy. Before I define what a fibroid is, allow me to direct your attention to the diagram of a female reproductive tract on your right. In this diagram, you can see fallopian tubes, ovaries, uterus, cervix, vagina, endometrium, and the myometrium. One layer that has been highlighted for you, the myometrium, is a smooth muscle layer. With that in the back of your mind, allow me to define what a fibroid is. A fibroid is a commonest benign tumor of the uterus. You might be wondering what the terms benign or tumor means. Benign means non-cancerous, and tumor means an abnormal growth of cells. In simple terms, a fibroid is a non-cancerous growth from the smooth muscle layer, or arising from the smooth muscle layer. Now that we know about fibroids, why is it important for us as Daisy Care to talk about fibroids? According to Duta's textbook of Gynecology 6th edition, it is estimated that at least 20% of women at the age of 30 have fibroids, whether they know it or not. Did you also know that as a colored race, Africans are at a higher risk? 75% are symptomatic, means they do not show signs or symptoms. 3% are symptomatic, means they do show signs or symptoms. According to Stanley O's research entitled Incidence, Etiology, and Epidemiology of Uterine Fibroids, it is estimated that the prevalence of fibroids was highest between 35 to 45 years. At this point, I would like you all to take note of the age of women I'm talking about. Ladies and gentlemen, according to UNICEF Country Profile, reproductive age in Zambia in women is between 15 to 49 years. These are women with passion and ambition to be valuable members of their society, and we need to create awareness of this common and treatable condition that affects their age group specifically. At this point, it wouldn't be fair to go on talking about fibroids without classifying them. This is important because it helps us understand the problems it causes and different treatments that we can advise. Today I have for you a classification that divides fibroids into 5 different types. Please note that there is also the FIGO classification, which uses different parameters but is similar to the one I'm about to tell you. This simple classification is based on the place where the fibroid grows. Intramural. Intramural fibroids develop in the muscle wall of the womb. Subserosal. Subserosal fibroids are projected outward but are lined by the outer covering of the uterus, and they can become very large. Submucosal. Submucosal develop in the muscle layer beneath the womb's inner lining and can grow into the cavity of the womb. Cervical fibroids. Cervical fibroids are simply fibroids that arise from the cervical region of the reproductive tract. Pendaculated fibroid. These are subserosal or submucosal. They are attached to the womb with a narrow stalk of tissue. Now that we've talked about the classification of fibroids, you might be wondering what causes it. This brings us to etiology. Despite the advances in medical sciences, the exact cause of fibroids is not known. However, 3 major factors have been implicated. Genetics, specifically chromosome 6 or 7 deletion or rearrangement, has been associated with fibroids. We all know that a human being has 46 chromosomes, each playing a vital role in who we are and body functions. Hormonal, predominantly estrogen dependent. Fibroids are referred to as estrogen dependent tumors as they are more likely or they are more common in the reproductive age group and increase during the state of estrogen. For example, pregnancy. The third being growth factor, both directly and indirectly affects estrogen. Growth factors which can stimulate fibroid growth or indirectly increase estrogen production. ECM, extracellular matrix, increased in fibroids and stores growth factors. With this in mind, we know about the etiology of fibroids. But why is it that some women have fibroids and others don't? So this brings us to risk factors. There are many topics including fibroids that are posted on the Daisy Care Facebook page and have the term risk factors. Risk factors are simply characteristics or behavior, that may increase the chance of getting a fibroid, that may increase the chance of getting a disease, In this case, it has been divided into modifiable and non-modifiable. As the actress Kenya Moore once said, and I quote, "My family never told me some of them had issues with fibroids. If we had those conversations when I was younger, maybe I would have gotten help for mine sooner." With this, we see the importance in creating awareness, as someone might get help before it's too late. A few of the modifiable risk factors listed here allow for lifestyle changes before someone gets fibroids. Number of pregnancies. Women who have never given birth show to have a higher chance of getting a fibroid. Artificial drugs. In this case, I mean hormonal drugs such as estrogen-based contraceptives increase the chance of fibroids. Obesity. Someone who is obese has a higher chance of getting a fibroid. Diet. In this case, I mean vitamin D deficiency, or someone who is lacking in vitamin D has a higher chance of getting a fibroid. Alcohol use. Someone who consumes alcohol or uses alcohol has a higher chance of getting a fibroid. It is also important to talk about non-modifiable risk factors to educate people on the possibility of the disease. Black women, as well as family history of first-degree relatives, have shown to increase chance of fibroids. As shown, early menarche and ages between 35 to 45 years also have increased chances of fibroids. So everyone, here's a scenario for you all. Mrs. X, a 35-year-old woman, rushed to the hospital and tells the doctor that she has fibroids, only because her mother had it too. The doctor calms her down and tells her that even though 75% of these women are asymptomatic, means they do not show signs or symptoms, some of them do. Mrs. X then asks her doctor, "So doctor, what are the signs and symptoms of fibroids?" Here's a list of some signs and symptoms of fibroids. Menstrual abnormality. Menstrual abnormalities such as heavy or irregular periods. So this may be due to 1, increased blood supply or imbalance of thromboxane. Pain, abdominal, lower back, during or after sexual intercourse. Increased frequency urinating or difficulty urinating. You might be wondering why these two statements contradict each other. Increased frequency urinating. For example, a fibroid can grow so big, or a large fibroid can cause pressure on a woman's bladder. This causes her to visit the toilet frequently, to urinate frequently. Or difficulty urinating. A fibroid can grow big and it can block the passageway for urine to pass through the urethra. This causes difficulty in urinating. Constipation, pressure. Second trimester miscarriages or preterm labor. Enlargement of abdomen or fevers. Some of these, such as fevers, may be due to infection occurring on the fibroid. Now that Mrs. X knows about the signs and symptoms, let's also tell her about the complications. This may be due to the actual fibroid or caused by the presence of the fibroid. Before we begin, let me define what health is. According to WHO, health is defined as, and I quote, "Health is a state of physical, mental, and social well-being in which disease and infirmity are absent." Complications of fibroids can affect all these aspects of health. With that in mind, let's look at the complications. Anemia. Anemia, which is simply reducing red blood cells in the body, is seen usually due to the heavy bleeding with fibroids. Infertility. Infertility is not being able to get pregnant despite having frequent and unprotected sex for at least a year. A fibroid can block the fallopian tube, preventing conception. Placental abruption. Placental abruption is simply the premature detachment of the placenta due to pressure from the fibroid. Fetal growth restriction, malpresentation, and preterm delivery are some of the pregnancy-related complications of fibroids. You might be wondering what these terms mean. Fetal growth restriction. For example, if a woman has a baby or a woman has a fetus in her uterus and she also has a fibroid, the fetus will not have enough space to grow because of the fibroid, so it restricts its growth, which is fetal growth restriction. Malpresentation. We all know that a normal human being comes out, when a baby's born, it comes out head first. Malpresentation is where the baby comes out hand first or leg first. This is a complication due to the fibroid. Preterm delivery. Preterm delivery is simply a baby coming out before its time. And why does this happen? A fibroid can cause pressure on the woman's womb and it induces labor. So the baby comes out before its time. Risk of becoming cancer. A fibroid has a risk of becoming a cancer, although it is very rare. Degeneration. Degeneration, also known as rotting, causes pain. The fibroid itself can rot. Infection. The fibroid itself can become infected. Twisting of subserous pedunculated fibroid. Remember we said the pedunculated fibroid has a narrow stalk of tissue. This twisting, also known as torsion, causes pain, which is a complication of fibroid. Internal bleeding. A fibroid needs blood vessels attached to it in order for it to grow. The rupture of any of these blood vessels causes internal bleeding, which is an emergency and is a complication of fibroids. Increased production of cells, for example, increased red blood cells. Last but not the least, psychological and social complications. If a woman, for example, has a miscarriage or is infertile due to this condition, it might cause her depression, and society's pressure on her to have a child may take a mental toll on her health, or a child can take a toll on her mental health, And hence, it is important for us to look at the bigger picture when looking or talking about complications. Now that you've told Mrs. X about complications, how do we know for sure that she has fibroids? This is where diagnosis comes in. You might be wondering what diagnosis is. Diagnosis is simply the identification of an illness by asking questions, examining, and investigating. It is important to educate the public on what goes around in a health facility to understand the process of diagnosis. Diagnosis is divided into many components: history taking, physical examination, and investigation. History taking is asking questions related to the condition. Since we know that family history increases the chance of having fibroids, the doctor might ask if there's anyone in the family with fibroids. Similarly, they may also ask about artificial drugs, complaints of signs and symptoms, smoking, questions related to previous pregnancies such as, second trimester miscarriages. Physical examination. A physical exam involves checking vitals to make sure a patient is stable by looking, feeling, and hearing different regions of the body with the patient's permission. But remember, other conditions can also have the same signs and symptoms as fibroids, and that brings us to differential diagnosis. So if it's not a fibroid, what else can it be? First and most importantly, pregnancy. As the saying goes, every woman of reproductive age is pregnant until proven otherwise. This is important to ensure the safety of both mother and child. Others to think about are cysts like fluid-filled cavities, tumors of surrounding organs, cancers, infections, polyps, and many more. Investigations. Investigations help the doctor to evaluate the fibroid and any complication. Different methods are used based on availability and recommendation. They are divided into two: lab tests and imaging. Labs involve using body fluids such as blood and check for hormonal levels, hemoglobin levels, pregnancy tests, white blood cells, and other supportive tests for the condition. Biopsy can also be done, though imaging is preferred. Imaging involves visualizing the actual fibroid using ultrasound, MRI scans, CT scans, and many more. They're important as different treatment options can be offered based on the findings. Once fibroids have been confirmed, different treatment options can be given to the woman. It is important to educate our community on different options for treatment. This allows a consideration of cost, choice of treatment, availability, and latest advancement. With that, there are three major methods of treatment: conservative, surgical, medical. Conservative aims to mainly educate the patient and encourage awareness, usually done in asymptomatic patients. Now, let's look at the surgical options of treatment. There are different types of surgeries. Some with very fancy names to pronounce, but are changing lives daily. Myomectomy. Myomectomy involves removal of the fibroid. There are different types as shown in the slide based on the location of the fibroid and the size. Hysterectomy. Hysterectomy involves removal of the whole uterus, usually done when a woman does not desire any more children. Embolization. Embolization blocks the blood vessels supplying the fibroid, causing them to eventually reduce in size. Ablation. Ablation uses waves and/or lasers to remove fibroids, usually small in size. Medical methods. Medical methods aims to treat fibroids where surgical options are not possible. It is also used to correct any underlying complication before surgery and allows to reduce the size of the fibroid. Here are some drugs used to treat fibroids as shown by reducing its size. Bleeding, pain by acting on the hormonal axis. These are drugs such as gonadotropin-releasing hormone antagonists and/or agonists. Some of these drugs are used to treat complications of fibroids such as supplements, pain management, infection treatment, and blood transfusions when needed. Don't worry, we have come to the end of the presentation. I hope you have gotten a few points about fibroids and why it was important for us as Daisy Care to talk about them. I thought it was important to present this at Health Week at my school, to increase awareness of the condition, to offer support, to reduce the stigma, and to tell people that they are not alone. Our greatest hope is to create awareness and be a bridge between the community and medical personnel in seeking knowledge and care. Here are the references for the values and information I have used above. Ladies and gentlemen, thank you so much for giving me your time, and the executive of Daisy Care Zambia for giving me this opportunity to speak. Thank you.